vaccination of special population, and these population comprised of people with underlying medical condition, immunocompromised, pregnant ladies, and lactating women. So underlying conditions who have no contraindication to vaccine should be administered. In phase 2 to 3 clinical trials demonstrate similar efficacy and safety profiles in those people who have medical condition where there is a high risk of severe COVID-19 compared to person without comorbidities. So first of all, the immunocompromised persons, for example, people with HIV infection or other immunocompromised condition, or who take immunosuppressive medications or therapies might be at increased risk of severe COVID-19 infection. Though data are not currently available to establish safety and efficacy of vaccine in these groups, these individuals may still receive COVID-19 vaccine unless otherwise contraindicated, as we will discuss that later. Individual should be counseled about the unknown vaccine safety and efficacy profile in immunocompromised people, potential for reduced immune response, and need to continue all protective guidance to save or protect themselves against the COVID-19 infection. Then the pregnant woman. Though at the moment we don't have any data for safety of COVID-19 vaccine in pregnant women, animal developmental and reproductive toxicity studies are ongoing. Studies in human are ongoing and more are being planned. But the important point is that messenger RNA vaccine is not a live vaccine. They are degraded quickly by normal cellular process and do not enter the nucleus of the cell to alter the genetic material. If COVID-19 and pregnancy actually induces a high risk of severe illness and chances of ICU admission, mechanical ventilation, and death chances are there. And there might be an increased risk of adverse pregnancy outcome like stillbirth or preterm birth. If a person or a woman is a group of healthcare person, she can choose to get the vaccination to protect herself for the adverse outcome. A discussion with her healthcare provider can help her make an informed decision. Explanation and understanding can work here. Pregnant women, there are consideration for vaccination because of the COVID-19 community transmission risk high and her personal risk of contracting COVID-19. For example, she's healthcare worker or at high risk profession, and there is a risk of the COVID-19 to her fetus. The efficacy of the vaccine is very, very important, the 95% two-dose series. For the side effects, there is a lack of data about the vaccine during the pregnancy, though the side effects are local and systemic has been noted. Pregnant women who experience fever following vaccination should be counseled to take acetaminophen as fever has been associated with adverse pregnancy outcome. Routine testing for pregnancy prior to receipt of COVID-19 vaccine is not recommended. Lactating women or breastfeeding women, no data again for safety of COVID-19 vaccine. Again, the messenger RNA vaccines are not considered live virus vaccine and not thought to be a risk to the breastfeeding infant. If the lactating woman is a part of the group like healthcare personnel who is recommended to receive COVID-19 vaccine, she may choose to be vaccinated. Patient vaccine counseling. This is the most important part of the vaccination process. This counseling will boost the confidence for those who are receiving vaccine after the proper explanation. Counsel vaccine for patient about expected local and systemic post-vaccination symptoms. Majority of those get only the mild local uh, reaction, though there are some systemic reaction has also been noted. Uh, this actually vaccine consists of two vaccine series, one dose 1 and dose 2, and they should be encouraged to complete both of them because the protection is complete after getting two doses. Antipyretic or analgesics medication may be taken for the treatment of post-vaccination symptoms. Routine prophylaxis is not recommended for this vaccine. Again, efficacy of the vaccine is the most important part of counseling and which will boost the confidence in those who are receiving. Efficacy after second dose is 95%. Patient should also be counseled to complete two doses because the optimal results or optimal production is only achieved with the two dose series. Public health also recommends certain important points which should be counseled and informed to the patient. Number one, two dose series, and it will take 1 to 2 weeks following the second dose to consider fully vaccinated. So that should be explained properly. And no vaccine is 100% effective. This vaccine is 95% effective and efficacious after the second dose and after the considerable or specified time period. Well, actually, this vaccine is new, no uh, good data available. So, vaccinated person should continue to follow all current guidelines to protect themselves and to protect the society. And in these, number one, wearing a mask, staying at least 6 feet away from others, avoiding crowds, washing hand properly, and if there is possibility of travel, serious travel guidance should be followed. Follow Following quarantine guidance after an exposure to some with COVID-19, following any applicable workplace or school guidance, contraindication and precautions. Severe allergic reactions, which may induce anaphylactic reaction, should be avoided. If this happens, appropriate immediate treatment should be available. There are certain precautions which should be followed. A severe allergic reaction to any vaccine or injectable therapies, intramuscular, intravenous, subcutaneous, is precaution to vaccination at this time. A vaccine provider should observe patient after vaccination to monitor for the occurrence of the immediate adverse reactions. Person with a history of anaphylaxis should be observed for at least 30 minutes, all other person for 15 minutes. This is the triage for those coming for vaccination, and this green one that indicates proceed with vaccination, and yellow precaution to vaccination, and red is the contraindication to vaccine. Patient with the immunocompromised condition, pregnancy, lactation. Of course, these are the special conditions, so special action should be taken, and that is the counseling and observation after the vaccine is required. And at least 15 minutes observation for these people. And those who the moderate, severe, acute illnesses, there should be risk assessment, potential deferral of vaccination, 15 minutes observation if vaccinated. If there is a history of a risk should be assessed, potential deferral for vaccination, and 30 minutes observation. A contraindication, severe allergic reaction, history of severe allergies, reaction, anaphylaxis of any component of the vaccine should not be vaccinated. Interpretation of the SARS-CoV-2 test result in vaccinated person. COVID-19 vaccine will not affect the results of PCR, SARS-CoV-2 nucleic acid amplification or antigen test. Antibody test. Currently available antibody test for coronavirus 2 assess immunoglobulin M or immunoglobulin G to spike or nucleic acid proteins. Thus, a positive test for the spike immunoglobulin M and immunoglobulin G should indicate either prior infection or vaccination. It will not differentiate. Only the time will differentiate. To evaluate for evidence of prior infection in an individual with a history of COVID vaccination, a test specifically evaluating immunoglobulin G and immunoglobulin M to the nucleoprotein should be used. That can help if it is done before the vaccination or after the exposure to the infection. There are clinical resources from these data gathered. FDA COVID-19, EU, FDA COVID-19 information, FDA EU guidance. Thank you very much for your attention.